Hey everybody, my name is Megan Galloway, and today we are finishing off our 3-part video series on birth control. So far, we have talked about the ins and outs of IUDs, we've discussed the progression of pills and patches over the years, and I've officially mommed you about permanent sterilization. Today, we are going to talk about the Nexplanon, the vaginal rings, the Depo shot, and other various forms of non-hormonal and over-the-counter methods. Remember, if you are enjoying this video series and you want to learn more about all things women's health and pregnancy, like this video and subscribe to my channel. So, you're thinking about the Nexplanon. Great! I love the Nexplanon. It is an excellent form of birth control. In fact, it is the most effective form of birth control out there other than permanent sterilization. It is currently FDA approved for 3 years, but the research actually suggests that it's good for 5 years. And so if you're thinking about getting a Nexplanon placed and your provider tells you it's good for 3 years, before you go getting it removed at that 3-year mark, make sure to check in and see if it's actually good for 5 years. People love the Nexplanon because it's easy. It lasts for a long time and you don't have to get an IUD placed inside your uterus. It's also great for people who can't have estrogen. It's a progesterone-only form of birth control, and it's great for people who are breastfeeding or have other contraindications to estrogen. So how does it work? It works by giving you a steady dose of progesterone, and that progesterone keeps you from ovulating. How is it inserted? Well, the insertion process is super easy, but some people are a little bit nervous about it. Honestly, the worst part about it is the numbing medication, and once that's over, all you should feel is maybe a little bit of tugging, pulling, and pressure. You will have a bandage on for a little while afterwards, and you will almost certainly have quite a bit of bruising on your arm, but these are the worst of the side effects of the insertion technique. Now, removal is a little bit different. Removal does take a little bit more time than insertion. What your provider will do is, again, numb your arm with the numbing medication. They do have to make a small incision, and then they use essentially little tweezers to pull it out. Luckily, most people don't need stitches after the incision, but you will have a little butterfly bandage in place, and again, another bandage on your arm for a little while afterwards. It's important to note that the insertion technique means that your Nexplanon is going to be just under the surface of your skin. So it's placed right here, and for some people, having something that they can see and feel afterwards kind of ekes them out, but it shouldn't hurt, and usually you get used to it. Feeling the Nexplanon is one reason people don't always love the Nexplanon. The other reason is that the bleeding profile can be really hard to predict. Best case scenario, you don't have a period for the duration of your Nexplanon while it's in place. That is awesome. People love that. Worst case scenario, you have bleeding on and off throughout the entire time you have it in place. There is a bleeding profile in between that every which way, and some people actually still have regular periods. We can't predict who's going to have which bleeding profile, and most of the time when I'm asked to take a Nexplanon out before it's due to be removed, it's because people don't tolerate the bleeding. The good news about the bleeding is we do use Nexplanon to control people's periods who have really heavy cramping or who even have endometriosis. And so even if you are bleeding, you likely won't have significant pain during the bleeding. There are a couple of other side effects that sometimes people complain about. Acne is one of them because of the higher doses of progesterone. The other is that sometimes I find that people who already have a history of anxiety and depression feel like the Nexplanon actually makes that worse. Next up, let's talk about vaginal rings. The one that's been around the longest is called the NuvaRing. The NuvaRing is great because it is, again, one of those things you don't have to think about that often. It is comprised of both estrogen and progesterone. It is a little ring about this size, and it is placed inside the vagina. On-label use is you keep the ring in for 3 weeks, and then you take it out for a week to have a period, and then you put a new ring in at the start of that new month. Off-label use, and the one that I find people to use most often, is to just replace the ring once a month. This allows you most of the time to be able to skip your periods, which most of my patients really enjoy. The second ring that's out there is fairly new. It was FDA approved in 2018, and it's called Novera. It's a slightly bigger, thicker ring, and it is a year-long use ring. On-label use, again, is to wear it for 3 weeks at a time, take it out, have a period, and then you put the same ring back in for the next month. This you can do over and over and over again for 12 months, and then you have to get a new ring. The off-label use, and again, the one my patients enjoy the most, is usually just to leave the ring in for the entirety of the year. Most patients don't have periods during that time, and it still effectively prevents them from getting pregnant. People like the ring, again, because it's easy to use and they don't have to think about it. It does take a little bit of time to get the hang of insertion, but each ring comes with a little pamphlet that tells you how to do it effectively. Most women, once they have their rings inserted correctly, don't feel their rings. And they worry about whether partners, male partners specifically, can feel their rings during intercourse. And most men say that they either can't feel the rings, or if they do feel the rings, they're not bothered by them. However, if you would like to remove your ring during intercourse because it's bothersome in some way, you can safely remove your ring during intercourse and you won't get pregnant as long as you put it in right after you're finished. Vaginal rings have a little bit less of a side effect profile than their pill and patch counterparts. Sometimes people notice that they have a little bit extra vaginal discharge. They also may notice that they have some spotting after intercourse, and some women have to readjust their rings on occasion in order for them to be comfortable. The last hormonal birth control method we'll talk about is called Depo-Provera, or the Depo shot. The Depo shot is a quarterly injection that is a dose of only progesterone, which effectively keeps you from getting pregnant. People love the Depo shot because, again, they don't have to think about it for months. The average time between doses is about 13 weeks. However, you get a little wiggle room and can really get it redosed every 11 to 14 weeks. This longer acting form of birth control is great because it's non-invasive, other than having to get poked about every 3 months. Most people have no periods on the Depo shot, which they love. Unfortunately, there is a small portion of the population who has bleeding kind of consistently on the Depo shot. And the bummer part about it is you can't take it back once you've given it. And so if you're one of the ones who has that unfortunate bleeding profile, you just have to put up with it until the Depo wears off. And then you just never get the Depo again. The other thing that I find with my patients is that some of them struggle with mood disorder with the Depo shot. The most common side effect of the Depo shot is weight gain, which some women find particularly bothersome. The other thing that I find in my patients is that some of them struggle with the high progesterone dose of the Depo shot, which can exacerbate symptoms of anxiety and depression. So if you're someone who already struggles with mood disorder, or you have particularly bad PMS during your normal cycles, you may want to consider other options than the Depo shot. The good news is this is a progesterone-only method, which means it's safe for most people. The thing to think about is that you are going to likely have to present to some sort of healthcare facility about every 3 months to get your injection. So if you forget when your next one is due, or you don't have time to go get your shot, you're not protected after about 14 weeks, and then you're likely to get pregnant. The last prescription-only but non-hormonal method of birth control is called Phexxi. Phexxi is fairly new. It is a vaginal lubricant that changes the pH of your vagina in order to stop the motility of sperm. It is unfortunately not covered by a lot of insurances these days because it's so new, but again, there are typically manufacturer coupons out there, and so if you really want to try this method, either go to the Phexxi website or talk to your healthcare provider about what savings options are available for you. Phexxi comes in an applicator and is used as a lubricant right before any active intercourse. It's important to note it is not a spermicide, but it does change the pH of your vagina so that sperm can't move well. Phexxi is meant to last for 1 hour, but depending on your sexual habits, if there is going to be more than one ejaculation, you do need to reinsert another applicator full of Phexxi prior to that one act. People love Phexxi because it's non-hormonal and they don't have to use a barrier method in order to prevent pregnancy. Some of the downsides of Phexxi are that for some women, it can actually increase the risk of vaginal infection or UTI, and it's not the most effective method on the market. It's actually only about 86% effective, and so I like to personally recommend that people use it with other less effective methods, such as coitus interruptus, which is also known as the withdrawal withdrawal or the pull-out method, breastfeeding, or natural family planning. Speaking of these methods, let's go over each of them briefly. First of all, breastfeeding. So I'm going to tell you what I tell my patients when I'm discharging them from the hospital after having a baby. Do not get pregnant immediately, which means breastfeeding is not effective. You never know when you're going to ovulate the first time after having a baby. It could be 6 weeks later, or it could be 2 years down the road when you finally stop that comfort nighttime feed. Starting your period for the first time after having a baby is completely unpredictable. It varies from person to person, and it often varies after each baby. And here's the kicker. You are going to ovulate before you have your first period. So you cannot rely on starting your natural family planning method or starting your birth control once you start your periods, because by the time you start your period, you may actually have already gotten pregnant. You're going to ovulate first before you have your first period. The only way to effectively do natural family planning while breastfeeding is if you're doing something like the basal body method or the cervical mucus method. This means that you are testing for ovulation daily and therefore can better predict when you might ovulate and better prevent pregnancy. Coitus interruptus. That's the medical term for the pull-out method or the withdrawal method if you want to kind of go in between the two. Let's just say I don't really consider this to be a method of birth control. I cannot tell you how many people have come into my office saying that they were using this method as a birth control method and whoopsies, we got pregnant. So unless you are okay with an oopsies, I would really recommend doing something like Phexxi along with your withdrawal method. Natural family planning or the fertility awareness method. This is when people are tracking their cycles and or tracking ovulation in order to prevent pregnancy. There are lots of different ways to do this. There's the calendar method when people just track their periods on a calendar or an app and try to predict when their fertile window will be surrounding their ovulation with that calendar in mind. There is the cervical mucus method where people are testing their cervical mucus daily in order to try to predict when they might ovulate. And then there's the basal body method where people are taking their temperature daily in order to predict when they might ovulate. All of these things that people use to predict when they might ovulate are helping them to avoid having intercourse during their fertile window. This is effective if you really have very regular periods or if you're really on top of your method and can track it effectively. Unfortunately, for people who have irregular periods, a lot of these methods are hard to use. The least effective of the fertility awareness method is the calendar method. This is really when you just write down your periods and then some app tells you when your fertile window is. Unless you have always had and consistently continue to have 28-day cycles, you can't always be certain when you're going to ovulate. If you do have 28-day cycles, you are almost guaranteed to be ovulating 14 days before your period starts. If you do have regular periods and you are using the calendar method, you'll want to avoid intercourse during your fertile window or use a backup barrier method. There is a lot that goes into cervical mucus tracking, and so I'm not going to explore that with you today. If you're interested in that method, there are classes out there that teach you how to do it, and they usually go for months of learning before you're feeling really prepared to use that method. Basal body temperature tracking, however, is where you use a thermometer. Some people use a specific basal body thermometer to track your temperature every morning before you get out of bed. As you're doing this, you might notice that on one morning, you get a very slight increase in your overall temperature. This means that you've likely ovulated. Now, you can't count on this method for predicting ovulation in upcoming months unless you have regular periods that go along with it. The problem with basal body temperature monitoring is that your fertile window actually starts before you ovulate. So unless you can predict when you are going to ovulate, simply knowing that you've ovulated does not help you avoid intercourse during your fertile window. The last method we'll discuss today is the barrier method. The barrier method comes in a few different forms. There's the male condom, which we've all heard of and probably got the condom on a banana talk some point in our life, and so we won't really go over that one. There is the female condom, which is a lesser known and lesser used condom, but a lot of females like this method because it gives them more control over their prevention of pregnancy and STIs. Female condoms can be bought online and they can be inserted into the vagina, and then that insertion protects people against pregnancy and STIs. Lastly, there's the diaphragm. Now, diaphragms are kind of an old school method of contraception. That and the cervical cap are not really used much anymore. But they are making a comeback, which is kind of cool. And one of them can be bought online. The thing about diaphragms is they do not prevent pregnancy on their own. They need to be inserted into the vagina prior to intercourse, and they need to be used alongside a spermicide or contraceptive gel. Diaphragms of old had to be fitted by your healthcare provider, but the new one that's available online is called Kaya, Caya, and that diaphragm is almost a one-size-fits-all diaphragm, and you can order it yourself and use it. It does need to be used alongside a water-based only spermicide or contraceptive gel. Their website gives you great examples of what gels to use. Barrier methods are great because they are non-hormonal and because it gives you control over your birth control in the moment. They also are protective for the most part against STIs. Unfortunately, a lot of people find them uncomfortable or think that they kind of take the romance out of the situation. So if you're looking to be spontaneous about your sexual life, a barrier method may not be the right method for you. And just a quick note on STIs, which is the new word for STDs. It just stands for sexually transmitted infections instead of sexually transmitted diseases. None of these birth control methods besides the condoms are actually effective at preventing against STIs. And so if you're looking to prevent STIs, you also want to add on a condom. And if you're interested in learning more about STIs, we will be doing a video series on STIs in the future. So remember to like this video and subscribe to my channel if you want to learn all about pregnancy and women's health in the future. But this concludes our video series on birth control. I hope you've enjoyed it and learned a thing or two. Please comment below if you have questions, thoughts, want to share your own experiences. Otherwise, thanks for listening and stay healthy, everybody.